NCLEX RN tips. Now I'll discuss tumor lysis syndrome. Tumor lysis syndrome is oncological emergency. So what is this? We can split this tumor lysis syndrome as three: tumor, lysis and syndrome. What is tumor? Any new growth is considered as tumor. What is lysis? Breaking of tumors is considered as lysis. And what is syndrome? Cluster of symptoms together is considered as syndrome. I repeat, tumor lysis syndrome. When the tumor get break, it can cause multiple symptoms. That is considered as syndrome. Fine. So, as I said, tumor lysis syndrome is considered as an oncological medical emergency. It can happen because of two reasons. Number one, massive destruction of the cancer cells. I repeat, massive destruction of cancer cells. Number two, when you start treatment, that is oncology treatment. What is that oncology treatment? Yes, that is chemotherapy. So when you start chemotherapeutic medication, or else the cancer cells get massively distracted spontaneously. What happens? See, imagine what is cancer cell. Cancer cell itself is an abnormal cell, whereas these cells are growing rapidly. So when these cells get rapidly distracted, what happens? Inside the cell, there are a number of components which is present. So when each of the cell get ruptured or each of the cell gets distracted, there are certain components which comes out from the cell. What are those? When each cell gets distracted, it releases number one, potassium, number two, uric acid, number three, lactate, number four, phosphate. I repeat, potassium, uric acid, phosphate and lactate. All these are considered as a waste, whereas potassium can cause arrhythmias. Okay? And when uric acid comes out, it can cause uric acid stones and it increases the workload of the kidney. And when lactate comes out, it can cause, again it is considered as a metabolic waste. It increases the workload of the kidney because the kidney has to excrete all these wastes. Plus the lactate can cause damage to the GI system, gastrointestinal system. When phosphorus comes out or phosphate comes out, it gets bind with the calcium and it can cause calcium phosphate. So the calcium level in the blood will reduce. So it can cause hypocalcemia. Ultimately, just imagine hyperkalemia, increased uric acid, hypocalcemia and lactate in the blood, ultimately increasing the workload to the kidney. So kidney is a vital organ that gets damaged. Fine. And when potassium increases, it can cause cardiac arrhythmias. So this is what it is considered as an emergency condition. So as I said, it is considered as an oncological emergency. So when you take care of a patient with cancer, immediately when on admission, you have to closely monitor the signs of tumor lysis syndrome, as well as when you start treatment, always be cautious that and you have to closely observe signs of tumor lysis syndrome because that is expected. So how can we assess? As soon as you get the patient, you can check an ECG. When you start treatment, you can check ECG. You can hydrate the patient well. You can assess the renal function test. Fine. Intake output charting can be done. These are the basic assessment that we should do. As a competent registered nurse, this is our responsibility to assess the patient and never put the patient in a risk. Fine. So learn everything in a systematic way. So when you get the patient, you can assess thoroughly and you can find out the key symptoms and interventions can be started immediately. So please learn each and everything in a systematic manner by understanding the basic physiology so that your NCLEX RN exam will be really easy. So I hope this is really clear. Tumor lysis syndrome It is considered as an oncological emergency where you can learn this tumor lysis syndrome as a split way. Tumor lysis syndrome. What is tumor? It's any growth is considered as tumor. A tumor can be two, like a benign and malignant. So we are talking about what? Malignant or benign? It's malignant. Yes. Because malignant cells grow rapidly. Lysis, which means it's breaking down of cells. And syndrome is the symptoms, 3 or 4 symptoms comes together is considered as syndrome. So thank you for watching. Bye bye. We'll meet with another video. Thank you.